A digital health solution invented to administer healthcare at the comfort of the patient's home is now offering home-based COVID-19 testing. Nancy Kimuyu with the details on the TIBU Health mobile app. Let's take a look at that.
Natalie Maikere sat at her dining table as a doctor in a lab coat unpacked her medical bag and took her temperature, pulse and blood pressure. Maikere is one of over 600 Nairobians getting medical care at home through TIBU Health, a Kenyan startup. It is a small player in a global movement towards home-based medical care, and its March launch coincided with the coronavirus pandemic that has forced much of the world's population to stay at home.
People, when they think of health, what do they think? They think clinic, hospital, I have to go there. So there's a bit of an education component whereby we're saying, actually, no, we'll bring everything to you.
TIBU also administers COVID-19 tests in people's homes. Customers start by requesting medical assistance via a mobile app. They get paired with the closest medical officer or doctor depending on their complaint. After a triage call, the health professional travels to the patient. According to Carmichael, the process from request to deployment takes an average of about 20 to 30 minutes.
So there's a bit of an education component whereby we're saying, actually, no, we'll bring everything to you.
The outsized backpacks contain equipment ranging from blood pressure gauges to kit for testing for diseases to tools that help with the management of illnesses like diabetes.
It is quite, the best thing about it is that it's portable. Like, can you imagine carrying a whole lab just on your back? I find that pretty impressive. Apart from that is that it's 3D patent, and then it has 3 different compartments. So, and it's actually easy to remove and to be able to use. You can even carry your lab coat as well as your stethoscope.
There are US companies offering comparable services like the Los Angeles-based Hill and New York-based Pager. But TIBU's price point stands at 1,000 Kenyan shillings for consultation, which is under $10. This means it is targeting Kenya's middle class with a view to expanding through Africa, where few such services exist at a scale. One challenge has been to create a digital system that safely stores patients' health records. Although there is a growing push for digitizing health records in Kenya, much of the information is still on paper only, raising the risk of inefficiencies and data loss. Reporting for TV47, I'm Nancy Kimuyu.
More or less a story that, is similar to what Tracy has prepared. And I think Tracy should be the best person to start off, weighing in her sentiments in regards to this. So much applications coming on board.
You know why I'm happy, Linda? First of all, this is time for self-promotion. Yeah. I work on Body Garage as well. Okay. That is our health show right here on TV47.
I'll be sending my invoice.
And to actually see these innovations during this pandemic period, remember, one of the most stressed out industries or sectors is the health sector. So to see people actually embrace technology and force us to use our phones and the technology that we have, because a lot of times, I know Mwangi here maybe uses his phone probably just for WhatsApp and calls and SMSs. For sure, yeah. So you have now more reason to be on your phone. It's just not a device for communication. We might actually need to use our phones for survival with health services being provided online, and this greatly reduces the number of people in hospital and still protecting our healthcare workers. So
Zain, come in.
Win.
Zain has done such stories before, and this is getting bigger and better, Zain.
Yeah, it's beautiful. Coronavirus or COVID-19 pandemic has brought out the innovativeness in Kenyans, and what can I say? I've done this kind of stories, and I'm happy that more and more of us are still continuing to do this kind of stories and to bring this kind of ideas out there. It's a really nice and beautiful innovation, Linda.
Sure, and maybe to pick from Zainab, you know that we Kenyans, we like to treat ourselves. So of course, when we get such a platform where you can know where probably you are ailing from, Therefore, and you get the you diagnose yourself. Therefore, it is a plus for us, we as Kenyans, who would like to maybe know your status even before you visit the hospital.
Well, I must also add to this. I know that perhaps a minority of Kenyans do not have smartphones, but then we have a majority, and we are edging towards now a period where almost everybody has a smartphone in their pocket or at home. And so now taking health digital is something that Kenyans now are taking it to the next level, and I must say that we're doing very good. And now health delivery is something that, it is.
And you know, Linda, my biggest worry though is us actually being able to use this for the right reasons. This is not an app. You see, we usually have instances where someone, you put your phone in the pocket, it dials, you know, and you have people calling the wrong numbers. Really hope you will see people use these apps prudently, especially because of the level of help that it can actually get to us. So
I think, Tracy, if a lot of education is done to people, I mean, we are a digital literate kind of generation. I think it's something that can be picked up very easily.
All right, need I say more? There you go. And we also, have seen the advent of the coronavirus disease that has since disrupted our way of life, and with restrictions that, to ensure that we curb the spread of the virus, in full effect. I mean, we have been forced to abandon plans that call for social